What we were doing in our state was quite different than that. It was a more modest proposal, if you will. And that was, we're not having government take over and run health care. Instead, we're trying to find a way to get people in our state that didn't have insurance insured. And also to make sure that people who did have insurance wouldn't have to worry that if they changed jobs, that they'd lose their insurance if, for instance, they had developed a condition, a sickness, during the period of time that they had been previously insured. Now, I know that with that summary about what we did and its differences with President Obama's plan, that explanation is not going to satisfy everybody. And I respect the views of those who think that we took the wrong course and who think we should have taken a different course. I also recognize that a lot of pundits around the nation are saying that I should just stand up and say this whole thing was a mistake, that it was just a boneheaded idea, and I should just admit it. It was a mistake and walk away from it. And I presume that a lot of folks would conclude that if I did that, that'd be good for me politically. But there's only one problem with that. It wouldn't be honest. I, in fact, did what I believed was right for the people of my state. And I'm going to describe for you now what I think would be right for the people of the United States, which is quite a different plan. If I were lucky enough to be in the White House in the position of leadership, on the first day I would issue an executive order paving the way for Obamacare waivers to be given to all 50 states. And then I'd go to work with Congress to make sure that we could repeal Obamacare. But now let's look at what I do instead. And let me begin with what I consider the objectives of my plan. One is do no harm. Two, strengthen the current health care system by lowering costs and improving quality. By providing portability, that's the ability to know that you're going to keep your insurance if you change jobs. Improve consumer choice. And then expand health care by dealing with those individuals who have pre-existing conditions fairly. And provide greater access to care for those that are low income or uninsured. 5 principles. Restore states to leadership. Empower individuals to purchase their own insurance. Focus our federal regulation as opposed to making it overbroad and over-bureaucratic. Reform our medical liability system. And introduce market forces to health care to the extent possible. What's to keep states from having a race to the bottom is the question. And the answer is that the people of that state are going to vote out of office the people that don't do a good job. States are competing. The great thing about the federalist system, where states have powers and responsibilities and rights, is that states compete for businesses, for high-educated individuals, for a workforce. We're competing with one another. I have learned from experience that one person and one government, the federal government, shouldn't impose their will on everybody else. And what I like about what I've described here is allowing 50 states to create their own approaches to the needs of their people. And as states compete, voters in those states will vote out the people that didn't come up with good ideas and vote in the people who have better ideas. And we'll end up with a system that's more effective, that gives people better care, and that shows the heart and compassion we always expect in the nation which is the hope of the earth. Thanks so much. It's good to be with you today.